Afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Prob. Thank you, Margie, and thanks to everyone for joining us to learn more about the latest local developments. Last week we shared that the data is showing a concerning increase in both COVID-19 cases and hospitalizations, and it appears the Delta variant is a driving factor. Since then, the uptick has continued and our numbers are clearly heading in the wrong direction. I want to take a look at our most recent data. Unfortunately, we have continued to see an increase in cases from last week. In looking at the 7-day rolling average, you can see that the sharp increase over the past few weeks. The average is up from a low of 5 per day on June 27th to 32 cases per day at the end of last week, ending July 24th. As we shared last week, hospitalizations have also been on the rise. As you can see on the chart, the 7-day rolling average increased from a low of 9 COVID patients on June 20th to 36 patients yesterday, July 26th. Today, we are reporting a total of 42 patients hospitalized with 3 on ventilators, and 27 of those are from Lancaster County, and the others are from surrounding communities. We haven't seen this many COVID patients hospitalized since back in last February. The Delta variant now represents more than 80% of the virus circulating in the United States, and it's the most frequently identified variant in Nebraska and in Lancaster County. It spreads more easily and quickly than other variants, and it's more likely to cause severe disease, especially in those who are unvaccinated. This next chart shows Lancaster County cases broken out by vaccination status over the last week. The green bar represents the daily case rate in people who are vaccinated. The orange bar represents the daily case rate in people who are unvaccinated. The bottom line is that you're 7 times more likely to be infected with COVID-19 if you are unvaccinated. Unvaccinated people are also more likely to be hospitalized. 88% of the people hospitalized in Nebraska over the past 4 weeks were not fully vaccinated. The Delta variant will seek out those who are not yet vaccinated and continue to spread if given the opportunity. Vaccination is really the best protection we have against the Delta variant. Vaccination helps prevent severe illness, reduces hospitalizations, and slows further spread in our community. When we prevent the spread of the virus, we also help prevent new variants from emerging. It's important to recognize that no vaccine is 100% effective, and some infections after vaccination are to be expected. However, the vast majority of people who are vaccinated are experiencing milder symptoms if infected, and they aren't nearly as likely to require hospitalization or to transmit the virus to others. The bottom line is you're more protected with vaccination than without it. We currently have almost 66% of our population 16 years and older fully vaccinated. We're making steady progress and getting closer to our goal of 75%. Now I want to look at the data for vaccination for all of Lancaster County residents. Currently, 54%, or around 172,000 people in our county, are fully vaccinated. They are shown on the chart in blue, and we continue to lead the state in the percentage of our population fully vaccinated. However, that still leaves around 43%, or 136,000 people, who are not yet vaccinated. Some of those are children under 12 not yet eligible for vaccine, which make up about 16% of our population, or 52,000. They're noted in the gray area. The orange area reflects others who are eligible for vaccine but haven't yet received it, and that's 27% of our population, or really around 84,000 people. These residents have no protection against the Delta variant, and we are concerned about them. We continue to urge every eligible adult and child to get vaccinated now, if they haven't really already, not only to help protect themselves, but also to protect the 52,000 children under the age of 12 who can't be vaccinated, and to protect our older adults who may not build as high a level of immunity after receiving vaccine. The small gray-blue wedge represents people who have received one dose of a two-dose vaccine. They make up about 3% of our population, or 10,000 people. So if you missed your second dose, get it now. You need 2 doses of Pfizer or Moderna to get the most protection. This chart that we're looking at now shows that the 12 to 24-year-old age groups have the lowest vaccination rates in our community. Children and young adults who are unvaccinated are contributing to the recent increase we are seeing in clusters of cases, such as in child care settings and summer camps. While the age groups generally have less severe symptoms if they are infected, we are seeing some young people with serious complications. And keep in mind that the people they could infect may be more at risk of serious illness. So joining us today by Zoom to share further information about COVID-19 vaccine in youth is Dr. Sean Jones-Jobes, who's a pediatrician and president of Complete Children's Health here in Lincoln. Thank you for joining us, Sean.
Thanks for the opportunity. I'm really excited actually to be able to be here and talk more about COVID-19 vaccination. We've had a really busy summer. We're getting all the pediatricians and family medicine docs in town have been getting kids ready to go back to school and sports with their physicals. And we've been lucky enough to actually be able to vaccinate kids in the office with COVID-19 vaccination from Pfizer for those kids who are 12 and up, thanks to a great partnership between pediatric practices and Lancaster County Health Department. So I would encourage parents who have questions about COVID-19 vaccination to reach out to their pediatrician and healthcare provider because they're happy to answer those questions. Our goal is really to try to keep our youth healthy and the rest of our community healthy too. As we start to see schools open up in the next few weeks, we're going to see more issues with kids who are infected with COVID-19 spreading it to each other. Just like we have had some outbreaks in daycares and camps with kids going back to school, we're going to start to see that as well. And with the Delta variant, that's a big concern that I have. The best way for us to protect our youth and our community is for people to get vaccinated who are eligible. The vaccine's very safe. We've been giving it all summer in our clinic. I've actually been excited about the fact that oftentimes I'll look at my schedule and look to see which patients are age eligible in the morning. And when I go in the room, those kids have already had their COVID-19 vaccine. They either had it at a school drive before school got out, or they've had it at a pharmacy this summer. So that's been reassuring. But the more kids we can get vaccinated, the safer our schools will be. I know that there are some out there that are concerned that maybe COVID-19 infection isn't going to be severe for their child. And so why should they get them vaccinated? And the reality is we aren't just talking about hospitalizations and ventilator status with kids. We see children, adolescents who have complications from COVID-19 like long COVID, where they have significant cardiac issues, weakness, cognitive slowing, and chronic fatigue-like issues that go on for several months, and we don't even know for sure how long those things will go on. We're also talking about missing school. Kids who get infected with COVID-19, the virus that causes COVID-19, will miss school, and that's a significant risk for them getting behind in their learning, and we want to make sure that we keep them in the school environment. They also carry a lot of responsibilities on their shoulders sometimes. Adolescents don't want to let their teams down by not being able to play their sports. They don't want to make their family members sick, their grandparents sick, their younger siblings sick, anybody who's medically fragile at home sick. That's a lot of burden for them to take on, and we want to protect them from that as well. So I would encourage everyone to reach out to their healthcare providers. Ask them any questions they have about COVID-19 vaccination. It is safe, it is available, and there really isn't any reason not to get your COVID-19 vaccine.
Thank you, Sean, for that very important information. And we really appreciate our partnership with Complete Children's Health and our other pediatric practices in our community. Our physicians in our community are remarkable partners, and they've been with us every step as we move forward. And I think it's important for you to know through these practices and our partnership with the pediatricians, more than 2,700 doses of COVID-19 vaccine have been provided to children, which is really critical. The changes we're seeing that are happening are really going quickly, and we continue to be very concerned about the shift in our local situation. For those reasons, our risk dial, which has been in green since May 18th, is moving from green to yellow today. This indicates that the risk of the virus spreading and the impact of our community is really moderate. In reviewing all of our local indicators, many of our key metrics have moved back into yellow. That includes case rate, positivity rate, healthcare system capacity, and deaths. The vaccination rate remains in yellow, and the average testing turnaround time and contact tracing remain in green. On the chart you're seeing now, the current position of the risk dial is in low yellow, represented by the blue square outlined in red on the color-coded map, just into the yellow. We have updated our public health guidance, and you can find it at covid19.lincoln.ne.gov. No further restrictions are being implemented at this time. Masks continue to be recommended for people who aren't vaccinated in both indoor and crowded outdoor settings. Adults over age 65 and anyone with underlying health conditions and other populations at heightened risk from COVID-19 should consider further precautions even if they are unvaccinated. Those precautions include wearing a mask in indoor public setting and avoiding close interactions with people who are unvaccinated. You may want to consult with your healthcare provider about additional steps you can take to protect yourself. Everyone who has COVID-like symptoms should wear a mask regardless of your vaccination status. For an additional layer of protection, people who are vaccinated may consider wearing a mask in indoor settings and crowded outdoor settings where distancing is difficult. We urge everyone to continue to monitor your health and to be on the alert for fever, cough, shortness of breath, and other symptoms of COVID-19. Even if you are vaccinated, you should separate yourself from others and get tested if you have symptoms of COVID-19. There are many testing options still available in Lancaster County. They include CHI Health, St. Elizabeth, and Bryan Health, and pharmacies including CVS, Hy-Vee, and Walgreens, as well as healthcare provider offices and urgent care clinics. We will continue to actively monitor the Delta variant and its impact on our community. If cases and hospitalizations continue to climb, we will make adjustments to our data-driven approach as needed. We've been winning this race between infections and injections, but with the Delta variant, it's becoming closer than we'd like to see. Our collective actions have helped shape the course of the pandemic in our community, and they will continue to do so now. Again, vaccination is our best protection against the Delta variant, and if you haven't received your vaccine, we urge you to get vaccinated now. And if you have questions about vaccine, again, we urge you to get answers from your healthcare providers, trusted sources. Vaccine is available at numerous locations in our community on a daily basis. To find a clinic near you, just go to covid19.lincoln.ne.gov or call us at 402-441-8006. And if you go to the website, you will also find the updated guidance on actions you can take to help stop the spread of the Delta variant and to protect yourself, our loved ones, and our community. Once again, the updated guidance is posted at covid19.lincoln.ne.gov. And with that, we'd be happy to take any questions.
Hi, Pat. This is Matt Oldring of the Journal Star.
Hi, Matt.
Hi. Hey, have you guys?
I know it might be a little bit too early, but have you guys seen any effect on case numbers or anything like that from the rodeo that was in town, or from any other large events that have happened recently?
You know, Matt, it's a little too soon for us to see much impact from the rodeo, and we're really monitoring for that. Where we're seeing impact is when we've had youth at camps and other activities where they've both been indoors and outdoors. That's one area. We're seeing multiple family members then become infected. But we're watching to see now in the next couple of weeks from the rodeo. But also keep in mind, many of those people don't live in Lancaster County, so their testing results will be outside of our community.
One more quick question.
For you, I noticed that vaccination rates have been going back up the past couple of weeks. Is there any kind of trend of who you're seeing? Are you seeing more kids in those age groups? Are you seeing more adults who maybe were hesitant before coming back in?
We're actually seeing more youth and their parents coming in. That's one group. And then another thing, Matt, that we've been doing too is, again, our active outreach to those who need their second dose and reminding them to come in and telling them locations they can come to. So those are two of the things in talking with the staff anecdotally that they're seeing.
Okay, thank you.
Pat, Andrew Ozaki from Channel 7 News, have you made any additional recommendations for Fan Day coming up or anything like that as you see large crowds coming in and interacting with athletes?
Yeah, we actually, we work with the university on a weekly basis, and we had a conversation yesterday and provided some additional guidance to them to use, and they'll be reminding people that if you're unvaccinated to please wear a mask when coming in, and making sure hand sanitizer is available, reminding people to get vaccinated and to avoid crowding each other. There won't be opportunities. A lot of times the fans crowd around the players, and that's something that's not going to be happening this year for both the safety of fans and the safety of our players.
Hi, Fred Knapp from Nebraska Public Media. Apparently the CDC is suggesting that vaccinated people wear masks indoors. I thought that was supposed to be just in hotspots. Are we a hotspot? And also, the governor is out with a statement that says the CDC announcement just furthers distrust that people have in that agency. The state of Nebraska will not be adopting their mask guidance. And he reiterates that schools should convene in person without mask or vaccine requirements. Your reaction to both the federal and the state developments there?
You know, Fred, I haven't seen the governor's statement, but I would say that's pretty consistent with the message that he's been providing. The CDC guidance, we're just barely over in our cases where they would say moderate risk for the masking, and our positivity rate that they use remains a little bit lower. I looked at that very quickly before I came down here. That just came out today at a little after 2. So we are saying, we have moderate risk. And as you just heard me, we're encouraging people with underlying health conditions and that to wear a mask indoors if they're in a crowded space, if they feel more comfortable doing that.
Hi, Alexa from Channel 8. So Garth Brooks concert, that's coming up in just a couple weeks. Just recently, Garth Brooks in Kansas City, they're doing a mass vaccination clinic to get as many of the fans that are going to be attending that concert to be vaccinated. Is that any idea of something you guys could see here, or, as far as masks and stuff too at this concert coming up, do you recommend that?
I think we will make any change in recommendations based where we are as a community then. But people don't need to wait for I would say for the concert. Now is the time they should be getting vaccinated if they're going, and I would urge those that are unvaccinated to get vaccinated before they go so they have the maximum amount of protection. We've seen in cases where Douglas County offered vaccination at the College World Series, and people aren't really interested in getting vaccinated. And the key thing here is people need to get vaccinated before the event, but we're going to watch what's happening, and if they have a great response in a separate clinic, we'll follow up and look at that. We're open to anything, but I want to remind people you can go every day to multiple places in our community to get vaccinated now.
Jared Austin from 1011 Now. Just kind of talking about CDC also coming out and saying that they want to see masking in K through 12 schools this time. Have you reached out to LPS or talked to LPS about this yet?
We've been meeting with all the school administrators in Lincoln and Lancaster County, and we are having a discussion about that, and where we're at with how things are in the community. There's several. The American Academy of Pediatrics is also recommending that there be masking in the schools. So we're working through that. The one thing I would say, you heard us give the message several times, Jared, that if parents have youth that can be vaccinated, they should get them vaccinated, and they should do it now. Because if your child becomes positive with COVID-19, they're going to be missing school. And that impacts not only their learning, but it also impacts parents' ability to work and fulfill their obligations. So I encourage parents that contact me that if they're more comfortable, they should feel comfortable having their child wear a mask in school.
Dale from KFOR is asking, are you going to issue a vaccination mandate for city or county employees?
No. There's a lot of discussion going on about that, and in several areas. Several big organizations, American Hospital Association and others are encouraging, and you probably saw there was an article in the paper today that was a visit with Dr. Carrie Ward from CHI about mandating mask mandates for healthcare professionals. And right now, there's an emergency use authorization for the vaccine. We'd like to see that finalized, and I think there's going to be ongoing discussions as we learn more about this. But the important thing is the vaccination is the one thing that we know that halts the spread of the disease, and we're going to continue to see spread and more variants. And I'm really concerned about those individuals that aren't vaccinated yet, that can be. We need them to do it for themselves and for our youth that can't be. Thank you for joining us today. I really appreciate it. And please let us know if you have questions.